Welcome to the We Are VIP podcast. Each week, your host, Casey Hasten, Director of Recruiting at VIP, will bring you valuable insights from thought leaders, introduce you to incredible companies, and bring you tips for landing your dream job from our team of executive recruiters at VIP. And now, Casey Hasten.
Welcome to the We Are VIP podcast, a podcast devoted to adding value to your career or candidate search, brought to you by VIP. I'm your host, Casey Hasten. I'm an executive recruiter, director of recruiting with VIP, and your all-around hiring guru. I love to help people find jobs, but even more than that, I love to bring exciting topics to the table in relations to your career or even your company culture. So today is no different. I'd like to welcome Chris Mathew, Chief Growth Officer of Sniffle Health. Chris has over 16 years of success in supporting the growth of physician practices and hospital clinics across the nation, and over 5 years co-founding a digital marketing agency. This man is busy, and 3 years selling and employee benefits. With his passion for ensuring everyone has affordable care and background in employee benefits, Chris has assisted in developing an amazing platform based on the needs he saw in the market. So we're going to talk about that today. So thanks for joining us, Chris.
It's my pleasure. Thank you so much for having me here.
You know, I always love to tell the story about how we met. So I'm gonna challenge you. Do you remember how we met?
I do. We met here.
We did.
At the studio.
This is where all the cool people hang out.
That's right. I was, like today, frantically trying to get ready for a podcast.
Yes.
Our own podcast that we host, and we met in the makeup room.
We call it the green room.
The green room. The green room.
It's about to get greener.
Absolutely.
No, for real, it's about to get truly greener. I'll have to show you after the podcast. So,
yeah.
You know, and I learned right before we came in, which I think is an amazing connection. I love that I get to meet so many interesting people, and that you were willing to share your story just a little bit, because I was absolutely fascinated. I was like, we have got to get together. You've got to tell me more about this. But right before we came on, we found out we had another mutual connection.
Amazing.
Yeah.
Joe
Nanez.
Joe. Amazing Joe.
We're not going to tell him you said that, because his head's already
I think we should. Joe, you're amazing. I remember that. And Joe and I, we worked together for a while in physician staffing. This is something I remember coming home from this trip that Joe and I took, traveling across the state of Florida. I think 3 or 4 days we were just driving across, meeting hospital system after system. And I remember coming home telling my wife about the trip, and I'm like, you know, we never turned on the radio, and I just moved on to the next part of the story, and she's like, hold on, rewind. You were in a car with a guy for 4 days, and you guys didn't turn on the radio?
Yeah.
And I'm like, Joe has a lot to say, and interesting stuff too, and
Yep.
I had a lot to say, and you know, every meeting was a chance to game film what we should have done, what we could have done, what we're going to do next. It was a great experience. And now to really blow Joe's head up, I say thank you, Joe, oftentimes when I pack. So we were on that trip, and I remember shaving, and I nicked myself. And Joe had this powder, like it would basically, you put this little powder on your cut, and it stops bleeding. And I was like, this is unbelievable. What is this thing? And he told me it's been around forever. You can get it anywhere. So I have that in my travel dopp kit. And so every now and then, I don't travel quite like I used to, but when I do and I see that, I just say, oh, hey, thank you, Joe. So
That's amazing. I need to say thank you, Joe, more often. You know, and one of the things I've learned working with Joe is that, and he is so supportive. He supports Success North Dallas. He volunteers there for us. He supports our young executives. He's mentoring one of our young executives from Success North Dallas. But one thing I know, like if I've got a really tough problem, first of all, I need to block a lot of time, because if you ask him a question, you're going to get a very thoughtful or well thought out answer, because he's going to look at it from every single angle, and he's going to process that through with you. So you need to make sure you have a lot of time before you ask him a deep question.
Yeah, I think that's tremendous. I mean, when people will be thoughtful and take the time to do that, that's not something you run into all the time.
No.
And I'll actually pass this on to you, that when we met in the green room, you started asking questions. I was kind of frantic and in a hurry, and you kept asking questions. And I was like, okay, well, she seems actually curious. And so we took the time. But then the real distinction is you followed up.
Yeah.
And you wanted to learn more. And
Yeah.
then we had lunch and you were very curious even more. And from that, you've made some really powerful introductions for me. And there's some exciting things happening with Sniffle Health because you took the time to be interested and curious. And that's really meaningful to me. So thank you.
That is amazing. And I'm one of those type of people that, I just want to put good out in the world. I don't really care about what happens. I mean, I do care, don't get me wrong, but I'm not going to sit there and monitor and say, okay, I did this, so this happened.
You're not chasing the credit. You're not seeking the ownership of, I did that. You better make sure that comes back.
Not at all.
Right.
Not at all. And so it's when I do hear stories like that, it just warms my heart. And it's like, that's why I do this.
Absolutely.
That is why I do
I
this.
subscribe to that philosophy of just give because it's the right thing to do.
The go-giver.
Yeah.
The go-giver. So let's talk about you. Tell us about your journey and the creation of Sniffle Health. I believe something happened with your dad.
Yeah. Health advocacy is a really important thing for me, but also for us at Sniffle Health. And it's something we want to make sure that we can bring to people in a really meaningful way. Being an advocate is about asking questions and making sure you really understand what's happening. Mm-hmm. Healthcare is really complicated. Sorry, shameless plug. Healthcare ain't easy. It's not.
It's not.
It's not easy for lots of us to try to understand. So then trying to be an advocate for yourself and asking the right questions can be even more complicated because you don't even know what the rules are or how this game board is set in the healthcare world. With my situation, my dad went to the doctor. My dad passed when he shouldn't have. My dad went to the doctor and was feeling really terrible. And upon going to the doctor, asked for an EKG. They did an EKG and they found a right bundle blockage. The doctor dismissed it and said, not a big deal. 20% of people are walking around with that. Here's the problem. My dad was over 65, a diabetic on high blood pressure medicine, whose father died of a heart attack, and is complaining of chest pain. You do an EKG, you find a blockage, and you dismiss all of those factors. That's not what should have happened.
Right.
But they dismissed it. He came back in a few days later, really complaining more pain. They gave him some codeine, they gave him some cough medicine, just indigestion. Really bad indigestion, but you're going to be fine. He went back in a third time. This was the 10th day after he had gone initially. They couldn't find his pulse that day. The pulse oximeter they put on there, and his pulse was so weak that it didn't register. They still sent him home. That evening, I'm having dinner with my wife. I call my dad. He sends me to voicemail, sends me a text, just says, I'm too tired to talk. I feel really terrible. I feel like I'm dying. I text back, Dad, you're not dying. You're going to be fine. I'll call you tomorrow. I'll check on you tomorrow. And about an hour later, my mom calls. Dad had a heart attack. I don't know what to do. Dad slumped over. I don't know what to do. I race there, and by the time I get there, my dad was gone. It took me a while to get to this place where I can talk about this, but it took me a longer time to be able to take all of that data, all of my dad's vitals, and put it into the diagnosis tool that we've created at Sniffle. And the diagnosis tool it has a 95% accuracy rating, and we can talk about that in a little bit. But I put the data in 12 times, and 12 times it said, heart attack, get to the hospital immediately.
Wow.
If my dad would have had this, it's not about questioning or challenging your physician. It's about being an advocate and asking questions. If my dad could have had this tool, maybe he would have. But at the same time, it was a relationship he's had with his doctor for 25 years. So maybe he would have dismissed it. Maybe my mom could have put the data in. And I know I would have for sure said, this doesn't make sense. A right bundle blockage and the indigestion. And I would have done this. And the data set return would have said heart attack. And I would have gone and taken my dad to the hospital. I can't say that my dad would be here for any number of reasons, but that wondering, no one should have to do that. And so the tools that we've created are to help people, to empower them to be proactive in their healthcare. Sniffle Health stands for better care, bigger picture. And the better care we're trying to bring to the marketplace is better care for physicians and clinicians, because burnout is a real thing there. Better care for us as patients so that we don't have to be in these type of situations, and better care for employers We're really focused on, if we can help an employer, they get to help all of their employees. And those employees get to help all of those clients and customers and communities. And that ripple effect goes on. And the bigger picture that we are focused on is that by using AI and advanced tech, we can help people live healthier lives. We can help people do all the things they want to do while they get to be here.
So talk a little bit about how you use the AI, or how that drove the development of Sniffle, because I know it's very heavy AI laden in the way that it does its predictions or its diagnostics. Did I say that right?
That's right.
Okay.
That's right. So my business partner, Rich, has been in telemedicine since 2011. And since he got into that space, what he really despised about it was the transactional nature of random doctors treating random patients. That doesn't work for healthcare. That doesn't work, in my opinion. It shouldn't be the way that healthcare is. You should have relationship with the people that are going to care for you. Continuity of care is something that really matters. So it started with the principle of how do we support continuity of care and relationship between a provider and a patient, a physician and a patient, because that relationship is sacred and it should be treated as such. And then going down the path of trying to figure out how do we support physicians to be able to do this. So before the pandemic, Rich had sent a survey out to about 3,000 doctors and asked them, why aren't you more interested in telemedicine? And the top two reasons of why physicians said they're not interested, one was the administrative burden is a beating. The juice isn't worth the squeeze, right? I'm going to have my front office staff do all the same intake, but the insurance carriers don't want to pay. Prior to the pandemic, they didn't want to necessarily recognize a telehealth consult was worthy of reimbursement.
Right.
And if they did, all the administrative work you've got to do to be able to document that to get $60, the juice wasn't worth the squeeze. Well, then the pandemic took place, and obviously everything went online.
Yep.
And every carrier said, okay, we're going to have to be okay with telehealth. So they did. And then the physician issue of, well, it's still costing me way too much in overhead to go collect $60. So that's where we started applying our solution. How do we digitize the entire intake process? Those forms, that like miniature book you fill out about yourself every time you go to the doctor?
I will not go to the doctor just because of that.
Stop that. Okay? Go to the doctor.
No, I'm going to Sniffle.
Yes, get your doctor on Sniffle, and then you don't have to do that anymore.
That's right.
We've digitized that whole process. So the intake process has been all of the friction points that are a beating for a physician. We've used AI and advanced tech to be able to clear the field of those problems so that a physician can be more focused on her relationship with her patient, because no algorithm can replace this.
Right.
An algorithm can help with advanced medical recall and all sorts of data to be able to get through the administrative burdens, and then allow the physician and the patient to spend more time doing this. So our diagnostics are the tool we call as our diagnosis tool, because our stance is that none of this works without the medical community. So only a licensed medical provider should give a diagnosis. But an diagnosis, or an AI-derived diagnosis, is an assessment that our AI protocol, so our AI is built on 17 million patient visits that have been loaded into the machine learning protocol.
That's a lot, right?
That's huge.
I'm just thinking, like, in terms of research, I don't know what constitutes a large data set. So 17 million would be considered
17
huge.
million is huge.
Okay.
Excuse me, especially when you think about this one scenario of medical diagnostics, physicians treating patients. And this is 17 million from around the world getting fed from different EMR systems all into this data set. And then where it becomes really powerful, Casey, is that you, the patient, you put in your family medical history, you put in your lifestyle, your social history, and then you put in your chief complaint or your first symptom, okay? If we both put that we have a stomach ache in there, obviously we have some differences about us.
Sure.
So the AI is going to factor that in, but also that a patient may have a family medical history of stomach issues. The AI is going to factor that in too. The questions that it would ask us are going to be different. And depending on how we answer those questions, it may ask us more questions. So as it goes through this medical interview and the AI is leading that process, the returning set of differentials, or the diagnoses that come back, have a 95% accuracy rate.
That is incredible.
It is amazing, because now people don't have to wonder, is it a gas bubble or is it appendicitis?
So let me ask you this. So this isn't like, I love how the nurses that were taking care of my mom, actually my cousin, she's a retired hospice nurse. She was like, don't be Dr. Google, So this is really in like WebMD. This is like 1,000 steps ahead of that, or in front of that.
This is. Obviously, I'm a little biased, but I'm also not wrong about this. I remember being a new parent and coming home, and my wife's a Google expert, and so we're just Googling the fire out of, are we keeping this child alive?
Because you don't get an instruction manual.
There's no manual. Either that, and we're wearing out FaceTime with our moms, being like, I'm pretty sure I broke him. I don't know what I did. I didn't mean to. Just tell me what to do. As a new parent, and as parents that are taking care of aging parents, there's all sorts of issues that come up that you don't know the right way to ask the question or pose the question or what additional questions you should be asking. You don't have to now because AI can be an advocate for you. AI can ask you the right questions, bring up the differentials. Here's the thing that I think is the most powerful is that, let's say it does say you should book a virtual appointment. The idea here is that you should book a virtual appointment, Casey, with your doctor, not just some doctor. So if your doctor is on the platform, then you hit a button, you see her schedule, you book an appointment. Before you enter the virtual consult with her, every question that was asked of you, she's going to see all the questions and all the ways you answered it. So when she does come into that consult, she's seen the diagnosis, that's come back.
Yeah.
And she sees every question, and she's going to be able to, she's not starting the consult with, hey, Casey, what are we doing here today?
Exactly.
She's saying, acute bacterial sinusitis, hey, this happens to you every March. I'm not concerned. Allergy, you have bad allergies, all good. Or she's going to say, this is unusual. Where have you been? What are you doing? What's different? What have you changed to suddenly start having these type of symptoms? And then she may say, I need lab work, or I need you to come into the office because I don't like this. The physician, she's still in charge. She's the quarterback. She's the one that makes all the calls. The data and the AI is just there to augment her and to support her in being able to be more focused on that in that appointment with that patient. That's what we've created. That's what we're trying to bring to the marketplace.
And it's so amazing. And like, I know I've downloaded the app. It's real easy. It's Sniffle for patients, right?
Correct.
And with that, without doing another thing, you automatically get the prescription card, right?
That's right. So the Sniffle RX card is 4 times more powerful than Good RX. Yeah, I said it. You heard it. It'll save you up to 10 to 85% on the prescription. You can, in the app, put the name of a drug in, the dosage, the amount of times per day your provider wants you to take it, and then you put in your zip code, Casey, and in real time, it'll pull up every single pharmacy within 5 miles and show you exactly what they sell the drug for. So you can say, Dr. Jane, don't send it to Kroger. This time send it to this CVS 2 miles down the road because it's $47 cheaper there. And
that's crazy.
I'll tell you what is crazy. It's like
watch us going crazy. I'm sorry.
It's all good. The pricing spread that's out there is really wild. And most people just have a prescription called in and they just go and they say, if my doctor said, hey, I need you to get these 2 prescriptions to get better.
Yeah.
You go to whatever that pharmacy is and you're like, $55 and $65, I don't have that money. What am I supposed to do? Well, with our app, you can be able to be intentional and proactive about where can I get this exact drug at the best price? And the pharmacy across the street could be selling those exact same drugs for a total of $20. Real world example, my older boy is on a monthly medication that used to cost us $50 a month. We now get the exact same medication, exact dosage for $8 a month. That's a lot of money.
That's a lot of money.
And that's just one prescription, right?
Wow.
The average household in the U.S. has 4 prescriptions. So you take that and look at those kind of saving potentials. That is in the app, and that's our gift to everyone. The diagnosis tool and the Sniffle RX card is our ability to say thanks for being proactive in your healthcare. We don't charge you anything for that.
Not even for the diagnosis?
No. We will never charge you. I want you to be proactive. I want you to know, is it indigestion or is it something more severe? And if I put money in between that, then I'm putting barriers between you and being aware of what's going on in your health journey.
I have to tell you, this would have come in really handy. My middle sister, a couple of years ago, she calls me and she's like, I don't feel so good. Don't you have some anti-nausea medication? Because I can't stop throwing up. And I was like, yes, I do. So this was the night before. And so I took it to her. I didn't think anything of it. She's throwing up. This will help.
Right.
Well, it didn't help. She kept throwing up. And the next day she's calling me and she's like, I am in so much pain. I'm like, where do you hurt? And she's like, I feel like I pulled a muscle in my side. And I'm like, I think you need to go to the hospital. And she's like, no, I'm not going to the hospital. 30 minutes later, she calls me back and she is screaming. This was the next day, almost 24 hours later. Her appendix had ruptured.
Oh, my goodness.
We had to call an ambulance and take her, and they had to do an emergency appendicitis on her. So I'm just thinking, the night before, had we had this tool? Because that was a whole another 4 days in the hospital.
Yeah, and she's okay?
She's fine.
Okay, good.
She's ornery.
That probably maybe runs in the family?
No.
Listen, I'm really happy she's okay. Appendicitis is not something to mess with.
Yeah.
Our app, we've had physicians. One of my favorite things is that we have a lot of physicians that have helped us build this. We have a lot of physicians that are on our advisory board and are guiding us and helping us shape this. When they first started getting involved, they would say, hey, your cute little robot's not going to out-doctor me. To which my response is, it's not designed to.
Right.
You're the doctor. This is your assistant. This is your tool. Let AI be your ally, not a threat to you. It's here to be your ally. And so they would go in and try to throw curveballs at it, right? They would try to say, oh, I have this symptom. I bet it's not going to catch us. They would throw little tricks in there to see, will the AI catch it? And the AI would catch it every single time.
Wow.
And when it did, they would be astonished and say it accounted for these different differentials, these different scenarios, and factored that in. And so if it's a gas bubble or it's appendicitis, those are dramatically different things.
And not a pulled muscle.
And so I'm really glad your sister's okay, but if she would have had this, she could have done an assessment for herself and realized, hey, I need you to get me to the hospital.
Yeah.
Because I have appendicitis.
And it might rupture.
That's a very real thing.
Yeah.
And you're not unique in that. And I'm not unique in the story about my dad. This is happening to communities and to people across the country. And it's just really hard for people to try to grab a hold of how am I supposed to understand what's what and what's real and what I'm supposed to do.
So, and I want to talk to you about another feature, and I believe this is under the paid, which is only like $15 a month, right?
Correct.
And that is the ability to talk to a therapist.
Yeah.
Talk to us a little bit about that, because when I was so curious, when I had just met you, we had just had an incident within an organization that I run. It's a community, Success North Dallas. I talk about it all the time, so I'm not going to repeat what it is here. But we had a couple of our members affected by suicide, and they had come to us looking for resources. If I'd have had this resource at the time, this could have been a game changer.
Yeah. So, Sniffle, we've got a couple different. Let me back up to say, you cannot buy our software. We've created this and built this, and we give this away. For physicians and patients to stay connected, you can't buy it. You can download it, use it, you can share it. Where we have to generate revenue, where we get to generate revenue is through a package of benefits that we sell in there. One of those benefits includes behavioral health counseling. The Sniffle Benefits Advocate Care package that you mentioned an employer can give this to their employees for $15 a month. And the behavioral health counseling is really powerful because these are all licensed counselors, the minimum of a master's degree with a minimum of 5 years experience and bilingual capability. And what you get with this counselor is, these counselors all across the country, is 6 45-minute sessions for a video chat or a phone call, up to you. 6 sessions per incident, but unlimited incidences. So if I'm stressed about work, I get to talk to the same therapist for 6 sessions about my stress. If I've got somehow suicide has touched my life and I'm struggling with the grief of that, I get to talk to a grief counselor for 6 sessions, the same person for 45 minutes each time. If I'm having a hard time being a parent, I get to talk to a family therapist. If I'm having a hard time with my spouse, I get to talk to a marriage therapist. The ability to have this curated, and the thing is, there's no additional cost. That $15 price for when it comes to the behavioral health counseling, that's all in, along with the dental and the vision and the labs and the imaging and the health advocacy. All of that is built into that $15 price. But I'm really proud of the behavioral health counseling part, because it's and it could be just now like confirmation bias, because now that I'm really in this space, but since COVID, I feel like a lot of people have been more willing to be vocal that they need help.
Yes.
And that they're willing to actually talk about needing help, but they don't necessarily know where to go.
Yeah.
Like your friends.
Yeah.
And how do you find it? And how can you afford it? And if you try to book an appointment with a psychiatrist that's going to write medication for you, well, there's a huge waiting period, and it's going to cost you a whole lot of money. But there are trained counselors throughout the U.S. that are standing by ready to help people through this talk therapy.
And I think, as far as it goes, from looking at it from an employer standpoint, and we've had these conversations internally at VIP, because when that situation came up, I realized, because there were 2 incidences within a week in our community. One was a daughter, one was an employee. And they had no idea. The employer had no idea that young person was so troubled, and it freaked me out. And so I had conversations internally. I'm like, we don't know what we don't know. We need to get ahead of this. We need to be asking questions so that we don't get surprised by this. Not that I think anybody's suicidal at VIP. That's not what I'm saying. But you don't know what you don't know.
You don't know, and people, lots of us compartmentalize really well, and we don't want to be a burden on other people. And I don't need to, bring you my problems, because I don't want to be an imposition to you. And people have that mindset and don't realize that people want to care for one another. As a human race, this is what we're here to do. We're called to love and to care for each other. But if you don't know where to start, it can be really overwhelming. And if the world's already feels like it's caving in on you, then you raising your hand and someone not immediately reaching out for you seems like, I tried and no one cared.
Yes.
And it didn't work, so I'm just going to shut down even more. Which is why I think, again, I know I'm biased, but it's why I really love.
I call you passionate.
I appreciate that. It's why I really love the benefit that we offer, because when you reach out to a counselor, they are the most empathetic people that you're ever going to encounter, and they are standing by ready, saying, "How can we be of service? How can we help you? What can we do for you today?" And that all of a sudden, it's like you're not in a waiting line, you're not in a queue. Someone's not going to get back to you and book an appointment 18 days from now. 18 days from now, I'm going to just go ahead and give up on it all. Or I get to start talking with someone today who can just maybe initially just hear me out. And I think those are really powerful things. I've benefited from this. I've used it myself, counseling services, and it's really, really powerful for someone to just sit across from you, and whether they're really interested or not, just to hear you out.
Yes.
For me, to hear me out and allow me to say some things that sometimes I was like, am I really this worked up about that? And my own light bulb would go off. Or in my case, my counselor was really good at helping me look at things from a different perspective and help expose some blind spots that I had, which really helped me tremendously.
I love that. And I love that you're willing to talk about that, because so many times it's like there's grief cooties involved, or there's, a stigma associated with going to a therapist. And I really think we just need to throw that away.
If I'm bleeding, I want a doctor. If I'm hurting inside, then I want a counselor.
There you go.
Yeah.
There you go. So where do you see the future, or what do you see in the future for virtual healthcare? Where do you see us going with this?
I think virtual care hasn't really been fully tapped just yet. The potential is still tremendous. And there's a lot of factors for why I think this. Joe and I, we worked in the physician staffing world together. Physician recruiting is a huge business because there will never be enough physicians to keep up with the demand. Being a physician is a really hard thing to do. The commitment and discipline you have to put yourself through, the liability you open yourself to, the medical debt you openly welcome into your life is crushing for most people to imagine. But even so, it's a really admirable thing for people to want to go be a physician. There will never be enough physicians to keep up with the demand of what we need as a country, especially the way that we live our lives here and consume our healthcare, or rather don't consume healthcare properly. We're a very unhealthy society, and that's not a judgment, it's just a matter of kind of a reality check of what's happening. If you're not going to have enough physicians to be able to care for everyone appropriately, then we have to find other solutions to be able to help fill the gap. And part of that is going to be virtual care. If you are, and I'm going to just make up, we're VIP Family Medicine. By the way, Dr. Casey, congratulations.
I like that.
Yeah. And we treat people here in Dallas. The reality is, if you have a Texas license, your license allows you to care for people in Amarillo to Corpus Christi, from El Paso to Marshall, Texas. The whole state is now is open to you. So it's no longer about, can a patient drive her car into your parking lot? It's a matter of, do you have a license to operate in the state? If the answer is yes, you can treat people. We've definitely heard of the term food deserts.
Yep.
Right? There are healthcare deserts too. Right? There are communities, and I'm not going to like pick on one. There is one that I normally pick on, but it was brought to my attention. You kind of pick on this community too much, so I'm going to not do that.
Dadgummit, you're going to tell me about it after the show.
I will for sure. But there are healthcare deserts, and so what if VIP Family Medicine were to say, hey, we're going to add another provider to our team. Let's hire a nurse practitioner. Let's hire Madison, nurse practitioner, and she's going to join us. And let's say Madison's bilingual. Great. We're going to run campaigns using smart marketing in El Paso and say, hey, at VIP Family Medicine, we know we can't be all things to you because we're based in Dallas, Texas. And I'm going to back up and say that I know that Sniffle Health cannot solve all problems, but I do believe that virtual care can solve about 70% of the issues that most people face in their healthcare journey. And that's powerful.
That is very powerful.
So think about if we're VIP Family Medicine, excuse me, and we're here in Dallas, but we're treating people and having impact in El Paso and in Brownwood, Texas, and in Houston and Austin and Tyler and Amarillo. Our ability to have a huge impact goes so much further than the brick and mortar that we're located in. Virtual care has been deployed somewhat in that way, but not in the way that it's really easy for people to use. It's really, I refer to our phones, our devices, it's your lifestyle remote. If you can't do it with your lifestyle remote, then odds are it's not going to happen.
Right.
With the exception of a few things. Your kids, your parents, your family, right? If I have to go through a bunch of friction to help my kid get better, I'm going to do that. If I got to go through a bunch of friction to help my mom get what she needs, I'm going to do that. But outside of a few other things, if you can't do it in the palm of your hand, I'm out. Because my life is too busy. If it doesn't exist on my lifestyle remote, you don't exist to me. And I think I don't think I'm unique in that way.
I don't think you are either. So, not anymore anyway.
Not anymore. So I think virtual care has the ability to help reach people really far and wide. But I also think, and this is a little bit aspirational, but I really am focused on this. How do we bring joy back into the medical world? If we can help a physician find joy in her practice again, and she doesn't just say, forget it, I can't do this anymore, enough's enough, I'm out. Every one time that we lose a provider to burnout or physician suicide, which is actually quite a problem, every time that happens, our situation here gets worse. So what if we could use virtual care and AI to help bring joy back to a provider and to bring joy back to a patient? Then I think maybe we can have more joyful stories and not all the horror stories we hear about in healthcare. You've
got some big aspirations, my friend.
I do.
You do.
I do, but I'm here for it.
I believe you, and I'm here to support you every step of the way. We are almost out of time, but I'm going to not ask you all three of our VIP questions, but I do want to ask you one because I know that you put some thought into it. So if your life story was being summarized in a news article, what would the headline be?
Okay. I definitely misinterpreted this question.
You're not alone.
Apparently, lots of people, I took it as my tombstone. What's going to be on my tombstone? I have a very lengthy tombstone. So I mentioned to my wife, and she's like, God, that's a lot of words on a tombstone. So I wrote that, bear with me, Chris's enthusiasm and aspiration to see the good in all was in fact what made him great. He lived by 2 rules that he and his wife had for their boys. Be kind and be respectful, especially when you don't want to be. So I think I'll turn that into an article.
I think you should.
And what do you think? Would you read that article?
I would read that article in a heartbeat, but you would have to mention the flying chickens.
Okay.
You didn't think you were going to get away with that.
Shout out to the flying chickens.
Shout out to the flying chickens. If you want to know what that's about, you're just going to have to reach out to him and ask him. So
yeah.
How do people get in touch with you?
It's chris@sniffle.com. It's singular, not sniffles, but chris@sniffle.com. And I'm on LinkedIn. I've been on LinkedIn for a while, so I'm just linkedin.com/Chris Mathew. 1T.
One T. So, all right. My friend, this has been amazing. I love helping to advocate for the work that you're doing because I think it is so important. That's why I was so curious the day that I met you. I'm sorry, I did not realize I was holding you up from something. But thank you for being patient and not showing that.
It was such a blessing. Thank you.
All right. I just have one last thing to say to you. You are a VIP.
Thank you.
And that's a wrap for today. Join us next week here on the We Are VIP podcast. We'd love to know how we can help you be a VIP. To find out more, log on to wearevip.com.